welcome to UoP Week. This is the Fight Cancer edition. Let me start that again. Hold on. Hello everybody and welcome to UoP Week. This is the Stomach Cancer edition. I'd like to introduce you to our panel here. It's Nav, Insha, Jit, Vin, and Ash. So without further ado, let's begin. So the first question I have for you guys is a fill in the blank. Men have more than double the risk of getting what than women?
Is it erectile dysfunction?
No, is it men have more than double the risk of losing every argument against a woman?
That is no, anybody know that answer?
Is it double the risk of getting gastric cancer?
That is correct.
Yeah, so some of the risks include Helicobacter pylori infection, smoking and consumption of whiskey. There's also associated risks with lower socioeconomic status, a family history of stomach cancer, and also if there's an elevated level of zinc and nitrate in the water.
Some other risks include diet, anti-inflammatory drugs, radiation exposure, and HRT for women. Gastric cancer is more common in older populations, and also people with blood type A are more likely to get gastric cancer.
Very good. All right. The next one I have here for you is a caption for an article. What does WCHTC stand for this picture?
Does it stand for Women Can't Help Taking Control?
Judging by the look on its face, I think its white character has total constipation.
Looks like it, but no. Anyone know the actual answer?
Is it a World Health Organization classify Helicobacter pylori as type 1 carcinogen?
That is correct. That is correct.
Yeah, so although the exact mechanism leading to gastric carcinoma is not clearly understood, the consequences of H. pylori infection on gastric cancer are multifactorial, involving host and environmental factors, as well as bacterial strains.
That is very good. All right, the next thing I have for you here is another caption. For this picture here, what does IFBLW stand for?
Innocent freckled boy looks wasted.
He does, doesn't he? That's not the antidote, really, no?
No, it actually stands for the symptoms a boy could be suffering from, assuming he has gastric cancer.
That is correct.
So the I stands for indigestion, acidity, and burping. Acidity and burping are often early signs of gastric carcinoma. F stands for fluid in the abdomen, which advancing carcinomas, some people develop fluid in the abdomen. This is called ascites. B is for blood in stools. In gastric carcinoma, blood goes through your digestive system and can make your bowel movements look black like tar. And L and W stands for lack of appetite and weight loss. Losing your appetite and losing weight, often signs of advanced carcinoma.
Very good, very good. All right, the next one I have for you here is another caption. For this picture, what does THC stand for? Anybody know?
Is it tetrahydrocannabinol?
Oh, I doubt it is.
Maybe it's Snoop Dogg's blood, like on an everyday basis.
It does look like it. No, but that is also incorrect. Anybody know the right answer?
I think its test helps find cancer.
That is correct.
So blood tests can be taken to look for the CEA, carcinoembryonic antigen marker, which shows up in stomach and other cancers. This is used along with barium X-ray, where a chalky liquid is ingested and it can show up abnormalities on X-ray, and endoscopy, where a camera is inserted down the throat into the stomach to look for abnormalities, and a biopsy can be taken.
That is correct. Very well. The next one I have here is what does the letters ECF stand for?
That's an easy one. Extenuating circumstances for me.
Oh, we've all been there, haven't we?
My goldfish is drowned 3 times already.
Every time your exams come around, I get a fresh case of chicken pox. But all right, so what is the actual answer? Anybody know?
It's the triple drug therapy: epirubicin, cisplatin, and 5-fluorouracil.
Very good.
Epirubicin works by causing cell death by causing inhibition of RNA, DNA, and protein synthesis. It also interferes with transcription and replication. It also causes the generation of cytotoxic free radicals. Cisplatin works by interacting with RNA, with DNA to form DNA adducts. This allows protein to bind, which inhibits DNA repair, thus causing apoptosis. 5-fluorouracil works by inhibiting RNA processing and DNA synthesis and repair. It costs per patient about £4,000, and cisplatin and 5-fluorouracil can be replaced with oxaliplatin and capecitabine.
Very well said, very well said. All right, next one I have a timeline for you. It's 8.3 months is the question. So what is 8.3 months? What is the question?
The average length of a Banting lecture.
Or maybe it's just how long it took you to realise you're still at uni.
Very funny, very funny. Both incorrect, although funny. What are the actual answers?
Well, I know what this is too. This is the median survival for a combination therapy.
Very good.
Whereas for a single agent therapy is about 6.7 months.
Right.
Combination therapies, as I mentioned before, is EOF, EOX. In HER2 positive tumours, you could use trastuzumab in combination with cisplatin and capecitabine.
Very good. So the next one I have in the picture here. What does MPB stand for?
Is there a reason why my face is up there?
I think it's quite obvious actually. It's obviously male pattern bulbous. But I think it's more referring to the side effects of chemotherapy, which is alopecia.
Correct.
One of the ways this can be slowed down is by use of a cold cap. Other side effects may include low white and red blood cell counts, tiredness, fatigue, nausea, diarrhea, vomiting, bruising and bleeding, mouth sores and ulcers, Palmer-Plantar syndrome, and arrhythmia.
Very good. All right. The next question here is to fill in the blank. There are 5 stages of what?
Maybe a student's life. So eat, sleep, drink, rave, and then repeat.
There's the 5 stages of a hangover. So still drunk, fetal position, throw up, promise never to drink again, and then still drink.
Last night, right? No. What is the actual?
Well, the answer is there are 5 stages of gastric cancer.
That is correct.
There are 5 stages from 0 to 5. With each progression, there's the cancer can grow to different layers of the stomach with increased node involvement. In stage 3, it can grow outside the stomach and into nearby organs. In stage 4, it can grow into other parts of the body, such as the lungs.
Yeah, very good. And this is the TMN classification of malignant tumors. The next one I have here is a number. The number 4 stands for what?
Is the amount of days you have to wait for a GP appointment.
That's fine. I didn't know.
I think 4 is the stages of prognosis. There are 4 stages of prognosis, from what I believe, and obviously, the later you are diagnosed with gastric cancer, the less chances there are of survival. So I think in stage 4, I think there's about a 5% survival rate.
Yeah. That's right.
Yeah.
All right. So next one I have here. Why doesn't somebody choose a topic for me on this wheel?
Dumping.
So what is the dumping syndrome?
What Ash has after having a curry.
Trying to make it viral is not my fault.
Does anyone know what it actually is?
Dumping syndrome is based on when food enters the small bowel a bit too quickly. This causes a reduction in blood pressure as well as an increased secretion of insulin. So the decrease in blood pressure makes you feel dizzy, as well as the high levels of insulin makes your glucose levels low, again feeling dizzy. So it's a dizziness feeling overall.
All right, very good. I'm going to choose another topic here. Well, what about support? Can you tell me about support?
In terms of support for gastric cancer patients, there are support groups out there which can help. There are also dietitians and nutritionists which tell them what they can and cannot have.
All right, and while we have time, we'll just jump on another topic here. What's about nausea and vomiting? What can we do?
Nausea and vomiting, the best thing is drugs, so you can take antiemetics such as domperidone or metoclopramide, hide it there. And also you can take any indigestion remedies.
Very
good.
Yeah, very good. All right, so the next one I have here is a few letters and numbers. What does LJM716 stand for?
Is that the new ID for Brad and Angelina's baby?
I don't think they've done what that's good. But anybody else know what that actually stands for?
LJM716 is currently a new drug in trial. It's based around biological therapy and is given with trastuzumab, which is a Herceptin or HER2 positive receptor and targets HER2 protein stopping them growing.
Correct. What about some other future therapies?
Also, other future therapies are bevacizumab with chemotherapy, and this is another biological therapy called a monoclonal antibody, and it targets the VEGF receptor, stopping cancer cells from growing their own blood vessels. One more whilst I'm at it. There's another HER2 negative drug, which is onotuzumab, which is given with chemotherapy, and I want to see the effects of it to see whether it can help cancers that have metastasized to other parts of the body, as well as has the presence of small amounts of HER2 negative receptors.
Very good, very good. Well, I'd like to wrap that up. That's been our presentation. It's been this week, Mock the Week. I've been your host, Sonny Devani. See you next week. Questions are welcome.
That wasn't too bad.
That was actually a smooth run.
Yeah,
So you guys start clapping again when I start clapping.
it's fine.
We should look at it.
Hello.
10 minutes.